Gum recession, believe it or not, is a very common condition. It's really a multifactorial process. It can be the result of periodontal disease, inflammation and infection, but it can also be caused by other factors such as trauma or genetics. And therefore, there's not always just one etiology or cause for the problem. In terms of the effects, it's one of the conditions, unlike gum disease, which many people do not feel happening or see the results of immediately. Gum recession is something that patients do notice themselves, and so it can be caught at earlier stages and corrected more easily that way. Gum recession in and of itself doesn't always require surgical intervention, but when it meets certain clinical criteria, we offer treatments for patients to help protect their underlying health and also to improve aesthetics. Primarily when patients come, they are looking at it from an aesthetic standpoint, although that's not always the case, but that is often the driving force. There is a fundamental health aspect to gum recession as well. We're dealing with the foundation of the tooth, and obviously when one sees the root, we've not only lost the gum, but we've lost the bone, and therefore we need to stop that process and reverse it as much as possible. And the way we go about doing that is often through surgical intervention. And there are many surgical methods today that are available to do that. Some are, are appealing in a less invasive way, but they're not always the only option or the best option for patients, but they can be, especially if the gum recession is caught early. Some of the less invasive procedures can be utilized very readily.